What is up, Healthcare Squad? Logan here with Healthcare Stress Relief, the company dedicated to helping you navigate these crazy times as a healthcare worker. Dive deeper into yourself, dive deeper into self-care, and really line up with your values and what you want through your profession and your life so you can live the life you really want. And if you're interested, right now I have a special, my Burnout Program just launched. It's in a beta phase. The price is very low right now for those early birds that want to jump in. I got 2 spots at the moment. Shoot me a message if you are interested. And in this video, I'm going to be teaching the #1 way to reduce your stress as a healthcare worker, especially during COVID. But this is a skill set that you can take with you for the rest of your life. It is imperative to your health. When I first moved to the location I'm at right now, I hired a mentor in this aspect. What is this aspect, you are asking me? It is breath work, breathing. What's crazy is most of us talk about health in terms of exercise, food, and sleep, right? Those are the 3 pillars of health. But the #1 thing people aren't talking about is breathing. Breathing is our most important thing. You can go weeks without food, you can go days without water, you can only go a couple of minutes without breathing. So we have to learn how to breathe properly. And I have a free video training course on breathing properly. I'm gonna go ahead and go into a lot of the things that I cover in there. But there are even more breathing techniques if you're interested in going deeper in the video training course. All you gotta do is put in your email. The link will be in the YouTube bio. So with that being said, the #1 thing people aren't doing with their breath is breathing through their nose. There's tons of breathwork researchers now who have found that breathing through your nose is one of the most effective ways to regain long-term health. There's scientist James Nestor. He has the book Breathe, and in this book he basically did a pretty crazy experiment where he paid a couple $1,000s at a Stanford research center in California to analyze him and another breathwork specialist, Anders Olsen, their breathing when they put silicone nose plugs up their noses. And so for 10 days they had these plugs up their noses. They could only breathe through their mouths from their baseline, and every day they were basically going into the lab, getting blood work done and measuring stress levels, all of this stuff, blood pressure, etc., etc. So after 10 days from their baseline normal health, when they first started, heart rate variability, which is extremely important for longevity. If your heart rate variability is really small, so let's say that your heart rate only varies between 80 to 90 beats per minute all the time, which is pretty rare, but if it's very narrow like that, then you have poorer health outcomes than somebody who has a very high variability. Someone who is, you can see this in cyclists who their heart rate can go all the way down to 50 and all the way up to like 160 when they're training. So heart rate variability, that went down. Their blood pressure shot up. They went from no hypertension to pre-hypertension, and I believe stage 1. They felt like absolute crap. They felt groggy, tired all day, didn't want to do anything. And then they take the nose plugs out and they tape their mouth for 10 days and only breathe through their noses. All of the previous existing conditions that were just developed went away. And what these researchers have found is breathing through your nose is actually an ancient practice. Many tribes, Native American tribes in particular, they used to actually put little headboards on their babies to keep them breathing through their noses. And many ancestral tribes believe that breathing is actually a form of medicine. And it's just so funny to me because we aren't taught this in nursing school or medical school. They basically tell you if the patient has a breath rate between 12 and 20, then you're good. If it's low or it's high, call RT. That's pretty much it. but they don't really cover any of this stuff. So breathing through your nose, number one thing to do. And at nighttime, what you can do is just get some surgical tape. You can probably find this in your hospital, and just place a little strip right here. This will keep you, it will basically train you to breathe through your nose. And sleep apnea is actually usually related to mouth breathing, and I think 50% of the population are mouth breathers. So if you're a mouth breather, you need to stop that crap right now. But I started taping my mouth at night, and my sleep got better. I stopped snoring, which is great if you have a partner, and I just feel much better. Now when I exercise and train, I breathe through my nose. The only time you should really open your mouth is when you're singing, or when you're eating, or when you're talking. That's what our mouths are for. Our noses are very important for purification of the air. So that's number one. Now, number two is breathing through your diaphragm. So let me put this camera down. You should be breathing through your belly, not with your chest. A lot of us, when we're babies, when we come out of the womb, we're breathing through our belly, right? But as life goes on, as life gets harder, we start breathing shallow through our chest. And that's not good. Gotta breathe through the diaphragm. Gets way more air into the system, and it allows you to get more air out as well. Now, with that being said, the other thing that you should also be doing is your exhale should be longer than your inhale. So if I'm going to inhale for 6 seconds, my exhale should be slightly longer, about 8 seconds. And I think the theory behind this is basically we are not driven on oxygen, we're driven on CO2. So if you exhale a little bit longer, it kicks in that CO2 drive a little bit more and allows you to actually get more oxygen in. It's very calming on the nervous system. If you go into the breathwork video course, I have actual breathing techniques, from pranayama to box breathing techniques that you can use in the workplace, before work and after work. These breathwork practices are extremely vital to your health. When I started doing them, it completely changed my life. Helped me get into meditation more. It helped me reconnect with myself. It helped me decrease my stress levels. The list goes on and on. I encourage you to look at breathing differently, because it will significantly change how you feel. So take what you learned today, apply it. Let me know in the comments what you think about this video, and subscribe if you haven't already. It helps me grow this channel, helps me help support more healthcare workers, so we can eventually change the system from the inside out. So thank you all for watching. Stay strong, Healthcare Squad, and I'll talk to you later.